Sleepteam.com conducted a recent poll of more than 26,000 mothers, and it found 1 in 5 admitted to giving their children medicine to get them to sleep. Now, experts suspect this figure is actually low. And I don't know what you all think, but I would surmise that maybe it is a little bit lower because a lot of parents are doing this. We have Deb on the phone who admits that sometimes she'll give her kids meds to help them sleep. And so, Deb, how often and what do you give your kids?
When my oldest was really young, a friend of mine told me to try an over-the-counter allergy med to help him sleep on the plane. Yeah, that didn't work. It was the complete opposite. It wired him. It was horrible. It was horrible. The doctor suggested we try melatonin, and it works like a charm.
But Debbie, I'm curious, the melatonin, how long has your child been using that?
He's been on it now for about 2 months. In fact, he said the very next morning, why haven't I taken this from day one?
All right. Well, you know, I've had a lot of parents ask about melatonin because it's fairly new. And what melatonin is, it's actually a hormone that the body produces itself while you're sleeping, and it helps regulate the sleep-wake cycle. So it actually helps you sleep. And we found that in adults and kids that it does, if you take a little extra as a supplement, it helps you sleep. Yeah. But the one problem is that for the short term, we found that kids, that it is safe if you're only using it for a couple of weeks. There aren't really any studies in kids using it longer than 4 weeks. Do we think it's probably safe? Yeah, it probably is, but we don't know for sure. There's also some precautions. If a child's taking blood pressure medication or has certain disorders like high blood pressure, seizure problems, depression, then you certainly should not be taking melatonin.
So, Deb, it sounds like you're in a unique situation here. You've been following the advice of a physician. We want to thank you so much for joining us and telling us your story. And best of luck to you.
Thanks so much.
Let's talk in general about the going to the OTC meds to get your child to sleep or do other things and experimenting in a way.
And let's start with why parents are pressured to do this. Moms they're stressed out, they're tired, they need their times. Okay, we understand, and people just don't like crying babies on planes, and they've had to put up with me for a lot of years with mine. However, if we start medicating babies when they're young, and then when they have behavioral problems when they're in elementary school, we give them another med, and then we complain when they're teenagers and they go to our medicine cabinet and become drug addicts to prescription medication.
Yeah.
We're medicating behavior.
We live in a society that is obsessed with taking pills, and it's a scary thought that we're teaching kids to get into this mentality.
But on the other side of it, you know, I deal with a lot of really tired moms, and they would do anything for just good night's sleep.
Are you recommending this?
I'm not recommending it. I'm just saying it's a coping mechanism sometimes just to get one good night's sleep. Sometimes we'll set you up for a lot more good night's sleep after that.
What parents are doing, which I agree with you on this, Wendy, I think starting in medical school, this culture is built into our brains. It is.
What's the diagnosis? Here's the pill.
Here's the pill.
But you know
we
what?
have to move away from it. We are starting to.
And
I will say as a medical profession, when pills are necessary, you know what? They should be prescribed.
And
when they're not, let's talk about it.
How I address that in my office, I say, yeah, you might need a pill for this behavior problem, but you also need skills. We talk about pills and skills. Cutting down on their TV, their video games, making sure they're getting omega-3s and their diet changes and exercises, all the other things that you have to be doing that could probably prevent that child from needing the behavior medication in the first place.
And my last comment, if you're out there taking sleeping pills, but you're also drinking energy drinks throughout the day, you've got to just look at yourself and figure out a way to start from scratch because one defeats the other.